Hey, welcome to Lead Up Podcast. I'm your host and publisher, Mike Harbour, and I'm really excited today. This is the place you come to learn about leadership, expand your thinking about leadership, talent development, and just becoming an elite leader. We try to bring great leaders onto the podcast to help you think differently about the way you're leading and just lead your teams, your organizations to that next level. Today, I'm excited to have a new guest with me. His name is Geoffrey Hall. Geoffrey currently he's the CEO of a behavioral health hospital. He's been in the healthcare business over 25 years now, so he's got a lot of experience to bring to the table. And he's actively challenging the status quo of traditional healthcare leadership, which is what I love. Because if you've listened to Lead Up Podcast enough, you know I'm always trying to break the box on how we lead. We have to do things differently today when it comes to leadership more than ever. We have outside pressures on us from the economy, from finances, from talent, and just having enough people to do the work in the world. And the world seems to be getting sicker, and the need for healthcare is greater, and it requires great leadership to face those headwinds that we have. So we're going to talk to Geoffrey about lots of different leadership topics today on the Lead Up Podcast. Geoffrey, welcome to the Lead Up Podcast.
Thanks, Mike. I'm looking forward to the conversation.
Yeah, when you and I talked a few weeks ago, you told a story and it reminded me a lot of myself. I was a young leader. I've always kind of been a hothead early in my life. I run pretty hot. I'm a high D on the disc. I'm very aggressive and assertive. And you told a story about you taking over a hospital when you were 23 years old, and you were Kabul in the china shop, so to speak, and someone had thrown some keys at you and said she had enough. So talk to us about that experience. First of all, how did you arrive there at 23? What was your ideas and philosophy about leadership? And what was the lesson you learned from that nurse that came in there and threw a set of keys at you and said she had enough?
Yeah, no, what a pivotal moment in my own journey. But I'm going to start this story by telling your listeners that in all truthfulness, no 23-year-old is prepared for the moment of running a hospital. And I made a lot of mistakes. And often you find yourself in those moments in life, whether you think yourself lucky or you drew the short straw. I was the last person standing after just a series of unfortunate events around the leaders that were more senior to me. People had family emergencies and another person went out sick, and the company I was working for was heavily committed, building out new hospitals across the country. And really somewhat unexpectedly, the state shows up to visit this newly opened hospital. The survey didn't go well. And within a day or so of that survey, the existing CEO had walked out. And I was in another part of the country, and I got the call from the company president and said, "How fast can you get to this hospital out west?" And I tried to push against that because I thought where I was and what I was doing was really important. But she's like, "Your ticket's at the gate. I'll meet you there." And it all started with, I was trying to run a leadership meeting with the in-place leadership team and write an action plan to the survey that had not gone well. And around 5 o'clock in the afternoon, after hours and hours of stress and frustration within that meeting, the company president tapped me on the shoulder and said, "They're not ready. You need to write the action plan, and I'll see you tomorrow morning where we have to present it." So quickly overnight, I did all those things that you try to do when you're trying to make a name for yourself. And I tried to overwork and over prepare and in some ways show off that I was ready for that moment. So I prepared the best action plan I could and did it overnight, no sleep, one of those days where you just push through adrenaline. And I showed up in that moment the next day, not knowing who I was presenting the leadership plan and action plan to. It ended up being the state's governor, the 2 state senators, the attorney general, and the head of various social and healthcare agencies in that state. And the president did a really great job of taking accountability and really talking about the kind of company that we aspire to be and that this was not our standard. And she really role modeled great servant leadership. And as I was in that moment, presenting that plan that I wrote on behalf, thinking it was on behalf of her behalf, that's when she announced that I was going to be the interim CEO of this hospital. And so 2 weeks later, I'm on the ground have landed. The hospital's got all kinds of unique challenges as a brand new hospital that just recently opened. And I'm working long days. I'm working 6, 7 days a week. And at that part of my career, I thought my goal was to try to outwork everybody. And I needed to be the smartest person in the room. And I definitely had a chip on my shoulder where I thought I needed to prove that I was ready for this moment and I was ready for this opportunity. And while I was always good at getting things done, the mistakes I made is I started to burn through a lot of people. And you make that early career move where you're new to leadership, where you get into that belief that what you're doing is the only way to do it, or it's my way or the highway. And I did have a staff member after a couple of weeks in that role, and I was setting a very hard pace and it was burning people out. And it was an end of a very long day where all the wrong stuff had happened and everyone is tired. And it was just she took the big janitor set of key ring with 100 keys on it. And she threw it at me and she said, "What are you going to do? You're going to try to run this place yourself?" And she was several layers below me, but I'm so grateful she had the courage to kind of speak up and challenge me. But I'll tell you, I did not like it. She really checked me, and I'm grateful that she did, because from that moment on, I stepped away and started thinking about what kind of leader I wanted to be. Because at 23, I hadn't thought I was going to have that kind of leadership opportunity. But getting that feedback from her, it really made me step back and say, okay, I need to do things differently. And I started to think about, how do I bring out the best in others? How do I really mentor and learn from other people? Because there were people on that team that were double, triple my age and had all kinds of life experience that I needed and needed to learn from. But I needed to set a different tone, and I needed to be a little bit more vulnerable and a lot more humble, and really start thinking about how to partner with people, not just manage people. So that whole conversation of management versus leadership, and it really helped me to set a whole different pathway where I knew my job was not to be better than anybody else. I'm not going to be the pharmacist or the nurse or the physician or even the best scheduler. My job was, as a CEO and a leader, was to bring out the best in others.
Yeah. So you're 23 years old. You think you know it all, but you learn quickly you don't, right? I
Good.
think there's a lot of things, right? Story similar to mine, and that I promoted quickly, mainly because I could get a lot done. And I think this is, as I look back over my 30 plus years now of leadership and healthcare leadership, I think that's maybe one of the biggest mistakes we make in healthcare is we promote people because of what they can get done themselves, but not what they can get done with and through other people, right? Which is the true essence of leadership. Leadership is influencing others to do things that they may not want to do that we need done, but influencing them in a way where they feel good about it, where they stay with us, they're engaged, and we're not bullying them to do it. I was a pretty good bully early in my life, Geoffrey, and pretty good at telling. I make the joke. I'm really good. I have two things I'm really good at in leadership. I'm really good at telling you what to do and how to do it. But that's not really leadership, right? So that's being an authoritarian and just bossing people around. But what was the hardest kind of corporate habit? You're young, so you're still still learning even just what leadership looks like from others' perspective. But what was kind of that hardest corporate leadership habit you had to unlearn, and what did it cost you personally? And I'll just give you an example of where I'm coming from. I was in the Army. I was a young leader in the Army. I joined the Army when I was 22 after I left college. And the Army is known for discipline and hard charge. I was a great fit for the military because I naturally already had a lot of what the Army taught. I didn't need discipline. I was disciplined. I was assertive. I was aggressive. I was all of those things. But luckily for me, I had some great leaders in the military that taught me, Mike, you got a lot of potential, but you're not a really good leader. You don't know how to talk to people. You don't know how to build relationships. You don't know how to influence. And so I had to unlearn a lot of things that were natural for me that kind of got me to where I wanted to be, but weren't going to get me to where I wanted to go. And so talk about that for yourself a little bit and what some of those corporate leadership behaviors were you had to unlearn or you thought were the right things. And then how did you go about doing that? And what was the cost to you personally for that?
Yeah, there's so many good answers to this. And I also appreciate your story because I can relate to getting a lot done and having that structure and being very disciplined. And I think as leaders, it's really easy to come into these roles with our own bias and our own experience and thinking that is the way and thinking that there's sometimes these steps that you have to take. And certainly at that moment of being a 23-year-old being in charge of a hospital, and I'm the first to tell you I wasn't ready, but at that moment, I came into that moment believing that I was ready and I was believing like that was going to be the next step. And one of those corporate behaviors that I have had to really unlearn is sometimes the person that has done the role is not always the best person to do the role going forward. And I think even now we're still in this place in healthcare where we've hired people that have already done the job and we sometimes close ourselves off to the people who want to do the job and might do the job a little bit differently and come from different backgrounds. And I think when you really start opening yourself up to more of a people-centered leadership and you start to learn their story and you start to learn their experience, and most importantly, you start connecting around purpose. If you can create a shared identity and consensus and purpose, and in healthcare, it always starts with, and I meet so many new employees of all different backgrounds, but the one thing they have in common in healthcare is generally everybody wants to help others and they want to make a difference. But over time, the system kind of grinds that out of you and you start thinking about your productivity. I can always tell a new leader because they're proud to have 8 or 10 meetings on their calendar. Like it's almost like a badge of honor that we overcommit ourselves to these number of meetings, but that's not actually where the work is. The work
Mhm.
is at its core is taking care of people. So drawing from my own social work training, that was a really good foundation for me in becoming a CEO, was going back to the people and the purpose, and then thinking outside of the box of not the title, not always the degree, but what they brought to the table, and then using that to better assemble a team that was safe and where trust was really developed and people were flexible and adaptable. And then, just like you said, I was individually good at getting a lot done, but I got so much more accomplished in a way that was sustainable and durable and really mattered when I started learning to work through other people.
That's really good. Take you back to young leadership, but it may be over the years too, not just in that first year as a CEO, but I'm I wrote a book called Quit Losing Talent, Geoffrey. I think you know. I talk about creating cultures where people want to stay. And I think it begins with leadership, my personal leadership first, right? To be able to do that in a team. But just looking back, knowing what you know now, how many people, how many talented people do you think you ran off because of your leadership style before you realize, man, I can't keep leading this way?
It's hard to quantify because the real answer is too many. And thankfully I recognize that because the courage of somebody that I probably could have fired or terminated on the spot for throwing a ring of keys at me challenged me. And in those days, as an early leader, I quickly burned through people. I was quick to take action against people and create. I thought I was creating structure and I thought I was creating leadership, but it was more of a fear based protection of where my own position. And over time, thankfully, that my own title is less important than my influence. And I would rather have relationships with people that are honest. You still need to have accountability. And in healthcare, there's a lot of talk about a just culture, but you really can't have a just culture because without accountability, fear without being human or the humanity of that, it just creates that bully culture. But if you can balance the human side of leading people with accountability, you start creating really strong results. I mean, like world-class level best practice. So for me to answer that question, there were burned through entire teams. It's dozens of people that were talented, were dedicated, were trying really hard, but because they didn't align to that early style of leadership, which I thought was right then, but was wrong in retrospect, I lost a lot of good people. And I think as my career has grown and I've been a CEO now 20 plus years, I'm now more proud of the people that I've raised up and mentored and the people that are able to lead big departments and run buildings and hospitals. And that's where I want the legacy to sit. I'd rather be known for those people than the title that I achieved.
Yeah, that's good. So let's talk to the young leader right now, because you've mentioned the term mentoring at least a couple times. Let's mentor the young leaders real quick. The young leaders coming up, they face that exact same thing today that you faced at 23 years old, right? And now you have
Mhm.
the history of 20 years of experience and developing yourself. Oftentimes, I see young leaders, they want to be different, but they face the pressures of above finance and healthcare,
Yep.
talent, quality, safety, all those kind of things. So what happens is maybe they come in with great intentions, but they end up doubling down on an authoritarian, rules based style of leadership. And maybe they're terrified of looking weak, which you kind of mentioned earlier. I think we all go through that as young leaders. We want to be the strong leader. But emotionally, how did you navigate that shift from the need to be right to getting it right? Because there is a difference, right? I have this need to
Yeah.
be right, but there's a greater need to get it right, especially as you grow as a leader.
Yeah. For me, I had to find my why. And so as a young leader, I was starting in behavioral health. I was always more relaxed around the patients or clients or the people that we served. And I always felt tight and tense with the people that I was leading. And when I started to go back and connect back to the purpose of what it meant to that person that we were serving and trying to stay connected to that, it helped me to change my style and start relating to the staff that I was leading differently. That you're going to hear me talk a lot about finding that purpose because I think that's where that identity is set. And purpose is not just the values of honesty and integrity and work ethic and all those things that as the ways that we show up. But you have to build an identity and a consensus, both individually and as a team, of what are we here to do? And one of the things that I do right now in my leadership practice is if my leaders around me, we feel like we're just overburdened and overwhelmed with meetings and to-do lists and projects, we've got to find ways to cancel and reduce some of those meetings and get back out on the floor talking to the very people that we serve. And you've seen other examples of this in other industries where Walt Disney, at its heyday of leadership, they implemented this practice where all their leaders took different roles inside their park, where they were serving lemonade and they were taking tickets at the front gate and they were staying connected to their customers, which then made them more empathetic leaders when they were making change or driving new initiative. And I think particularly in healthcare right now, it's so easy as you move up and your roles become more and more larger scopes of portfolio and responsibility, it's really easy to get away from the actual people receiving the care. And so I'm a huge fan of leadership rounding, and not just as an assignment where you go check the box, but it's like a team sport where you have to learn something about your co-leader or your coworker. You have to be patient facing. You have to talk to the staff as you're rounding. You're being visible and accessible. But then you also have to come back together and you have to debrief, because it's not just doing the activity, it's what you do from those lessons and what you heard. And I've created a model which gives some of that opportunities for new leaders to be partnered with senior leaders and to build some of that mentorship and bonding, but stay close to what we're trying to do. One, one last thing I would say is, to a young leader, you have to know your audience. And whether you're managing down, you also have to manage up and across. And that up and across, where you're building trust at a senior leadership level, is just as important as how you reflect management and leadership to the people that report to you. And knowing that audience and being able to adjust, because it's different inputs and different expectations. And that's where that communication is really important.
Yeah, that's so good. Let's talk about that for just a minute. How does one lead up? Because I think John Maxwell, I'm a junkie of John Maxwell's. I've been mentored, coached by John, worked with John. He wrote a book many years ago called The 360-Degree Leader. He talks about that leading up, leading across, leading down. How does one lead up to, maybe with a boss that is not a great boss, but I've got to work for that person? I can give some examples where I've done that really, and I've done it really poorly, but let's let's hear your take on that.
Yeah, no, I think there's a lot to that. And there's how you manage up is different than how you manage down, because the perspectives are going to be very different. And I don't know if anybody's actually, other than me, has observed this, but seemingly the higher you go in a title, the more emails you get and the shorter your email responses are. Like, if you're a senior leader in a big organization, you're not getting paragraphs of reply in email. And I've heard other executives and other leaders at that senior level, if they get a long email, they may not even take the time to read it because it's one of 1,000 emails. So it really starts with tightening up your communication and giving those most important salient points very crisp, very brief. And it really does need to be action oriented. And as I'm developing other leaders, it's really, particularly one-on-one in my meetings with them, I'm asking them, are you telling me about this because you just need to vent and you want me to listen to this? Or are you coming to me because you need me to do something? Or third, and most importantly, what have you tried and what support do you need to be successful? And framing those conversations, it takes a little bit of time to develop that trust, but when you can define those things, because everybody needs the safe space to vent, even senior leaders, CEOs are human too, but really helping people sharpen up their communication so that you know where the problem sits, you know what action you can be, action or solution oriented, that is actually trying to help move a problem forward. And oftentimes it's not to micromanage that, or I can't step in and do that for you, but we do need to have some awareness of what resources do you need or where the barriers are, so that we can put some thought to that. And when I'm mentoring a new leader, it's not about how busy you are. You still have expectations to get things done, but your willingness to ask for help, or your willingness to try new things, but then take responsibility if those things don't always work out. And that's where the learning happens. I've always thought there's two kinds of leaders I can help. One that wants to try new things, sometimes doesn't make the jump, but if they fall, they get back up and say, okay, this is what I've learned from that. I can help you climb and grow and have more responsibility. The other leader is that person that gets to that intersection and is really doesn't know to go left or right, but has a willingness to say, hey, I could use some help with this, it- before they make a mistake. And if you're either type of personality and you're willing to express that, you can build an environment where that person can be successful.
Yeah, that's good. You mentioned the term busyness. There's a lot of talk about burnout and overwhelm and those types of things, today's workforce. And in our call we had to prepare for today a few weeks ago, you talked about burnouts as a symptom, an upstream system, and that the real strategic focus must be on creating meaningful, deeply supported human experiences for our teams. So talk about that and what are some practices you as a CEO are doing and in challenging your leadership team to do to help alleviate some of that burnout for our teams?
Yeah, I love this question. I could talk all day about this topic. In healthcare, there's a crisis that has already started and it's getting worse. And it was really pronounced, of course, coming out of the pandemic, which was a lot of change and a lot of hardship. And some things have normalized, but the burnout has in some ways just deepened. And in healthcare, you hear about nursing shortages, you hear about physician shortages, and all of those things are true. And while certainly technology and AI are going to help in some ways, it's not the solution that everybody thinks it is. It's always going to come back to the people. One of the simplest practices that I teach my leadership teams to do as they're rounding and they're interacting with people is to have a 2-minute conversation that is not about work. And I really want you to get to 2 minutes. I can go longer than 2 minutes. But if you're out on the hallways or the units or you're walking around, have those 2-minute conversations, whether it's at the coffee pot, the water cooler, it doesn't matter. And really not about work. And what that does, because the work is hard. You don't have a magic wand. You're not going to magically heal sick patients that are experiencing a lot in healthcare. The work is hard, but that 2 minutes is the difference between being seen and heard, where you feel like the work is hard and you feel supported, or the work is hard and I feel unseen and it can be a really bad day and I just want to quit. If you can create in your practice where you're having those small 2-minute conversations about somebody's vacation plans or their son's baseball game or what restaurant they just tried, just those little human points in life, what happens inside that organization is you will see turnover start to go down, retention start to go up, employee referral for vacant positions will start to increase. So those hard to fill positions, you'll start to get a network of like-minded people that work hard and are dedicated and really care being referred from your in-house employees because they feel supported. And it's just as simple as those 2-minute conversations. Now, they're not always, you know, easy conversations. Sometimes when you start down those conversations, you get some really hard feedback and you get some really honest, raw, emotional feedback. And that's not a 2-minute conversation. So you've got to have the off ramp where you can really create space for those issues and for those individuals that are going to need a different level of support than a 2-minute conversation in the hallway. But if you create a culture where generally people feel like their leaders see them, care about them, are listening to them, have relationship with them in those small human moments, your quality will improve, your turnover goes down, your culture starts to feel a lot healthier. And in healthcare, the direct result of that is you'll also see patient satisfaction go up because that patient that's dealing with life-changing health issues also needs to feel seen and heard. And that's what we really need. And if we think about ourselves in healthcare or our loved ones or our family members receiving healthcare, that's what we want. We don't want more robots and AI. We want to know that somebody knows or at least tries to empathize with what we're dealing with and what makes us human.
Yeah, so good. I call that C squared grounding in my book, Quit Losing Talent. And all C squared stands for is connecting conversation. And, what rounding unfortunately became in healthcare is a great Quint Studer kind of introduced the idea of rounding 30 years ago, but what it became was a check the box. Yeah, I rounded on my staff. I asked them if they needed anything. They said no, so I kept going. And it became, yeah, I did my rounding where for me, connecting conversation is what you just described. Spend time with people on your team, get to know them, ask about their families, ask about their kids, ask about their, right now we're right in the middle of graduation season for high schools. Learn, know these things and about your people, because as Geoffrey has shared with us, Lead Up listeners, when you do those things, it's a ripple effect all the way to the patient experience. And because if our people feel cared about, the customer's going to feel cared about, because that just bleeds out into the way they interact with the customer, the end user of our services. Love that, Geoffrey. Let's talk about some things that you're doing internally with your organization to create a place where people want to stay, a culture where your team feels valued and they are becoming recruiters for you, so to speak, because they're networking with people and they say, hey, you need to come work for us. What are some internal tactical things you guys have implemented or you are implementing to reduce turnover, improve retention, improve employee engagement in your organization?
Yeah. And that's a timely topic for me because in my current role, I'm in a newer CEO role and I've been in it for a few months. So I'm coming into a team that I don't have all the history on, and there's a lot of opportunity with a little bit of fearfulness and distrust of a new CEO, and maybe some other leaders in the past didn't necessarily create some of those practices and some of that culture. So the first practice that I think is a great place to start, and you don't have to be clinical to do this, is authentic gratitude. And what I mean by that is every organization is going to have those year-end celebrations. They're going to have some kind of staff event, some kind of staff surveys, and some of those things are more meaningful than others, but in some ways they kind of check the box. And in a hospital setting, it's an environment that runs 24/7. And there's always going to be people that may not have as much exposure or visibility or contact. So in healthcare, of course, you've got night shift and you've got staff that are working on weekends and staff that are working on holidays. And you do have to be creative to reach all of those different layers where people show up. But gratitude is a great place to start, and not just waiting for the big milestones or the check the box kind of all staff celebrations.
Hospital week that was
Yeah.
just celebrated, right?
Well,
In the hospital world. So,
and that's one of the things that is also really hard because in that calendar, there's a week and there's a day, there's a month for like literally every profession. I'm not the kind of leader that I can't remember everybody's birthday. Like if I remember one person's birthday and I make a show of that, I'm going to hurt someone else's feelings because with the best intention, I just may not have remembered their birthday. But that person, if I'm remembering one person's birthday, they're expecting me to remember theirs too. And that's just not really doable for me. But every day there are these moments where people show up and they go above and beyond. And if you can create a system where we have in our hospital an opportunity to send that person a recognition note or a thank you note. And it's good because it goes directly to that person, but it also notifies their supervisor. And one of the things I've asked my other leaders around me to do is to copy me on those thank you notes that they're sending authentically to their staff. Because when they do that, then I can reply back to that person also using the influence of my position as CEO. And while I personally don't think I'm that special, there are people in the organization that are like, oh my gosh, I'm getting a note from the CEO.
that's right.
And the idea of that is it has to be role modeled first by leaders and it has to be authentic. It can't be forced. I don't like the copy 100 people and just the quick thank you. It needs to be a little bit more individualized, but it takes you 30 seconds to show gratitude. I mean, and again, it's the difference of a hard day where you feel seen and supported and a hard day that turns bad and you start thinking about quitting and moving on to the next job. So just showing that gratitude, and then where it's starting to take traction and that culture is starting to become more healthy, is when staff start recognizing staff and they're not in a leadership position, but it starts to become a lot more organic. And that gratitude in the best ways possible becomes contagious.
Yeah, that's so good. Yeah, I call it tactical praise, right? And praising people, STP, specific, timely, personal. Yeah,
With your military background, your tactical comes out even in your gratitude.
yeah, and look, for me, Jeffrey, these are all things that I had to, quite honestly, I had to systemize. I'm a believer as leaders, we can have big goals, but we fall to the level of our system. So I can have a great goal of showing gratitude to my team, but guess what? I get busy. I got
Mhm.
lots to do, and so if I don't have a system in place to remind me to show gratitude with
Right.
my team and make it specific to that individual and make it timely for that individual and make it personal for that individual, then it's inauthentic, as you say. Could be, hey, y'all get it, y'all did a great job. Everybody on the team's doing a great job. That's not specific. It's not, it may not be timely, and it's certainly not personal. And that's inauthentic gratitude. And so, yeah, I'm an acrostic guy, system guy, certainly, but I believe even your praise, you got to have a system to
Mhm.
look for it, right?
Yep.
And so in your rounding, setting myself up to, I'm going to look for opportunities to share gratitude. I'm going to look for opportunities to be curious about what's going, because most leaders are wired to go be curious about what's going wrong and point out all the things that we're missing or doing wrong. And so we have to systemize these things, especially those of us like me. I'm very goal and results oriented, task oriented. I have to have systems in place for
Yep.
me personally to recognize my team and my people and make sure I do those things. And I just follow the system in a very authentic,
Yeah.
relational way.
With
So
our system, it's those touch points that are the first thing that gets punted or put on the shelf because
yeah,
we get so busy. So just like you, I have a personal goal where I try to send out a couple a day. And whether it's how I start my day or I end my day, it gives me just a pause to say, who really stood out, and sending that note. And just to be fair, being a newer CEO in this current environment, it's at that threshold where it's starting to take root and it's starting to multiply, and you can start to feel it because where we had a lot of vacant positions, now employees are raising up and say, "Hey, I know someone." And it's it has a real business effect on us because as we increase our staffing, we're able to care for more patients. And
yeah,
that's a healthy business.
yeah. Look, I love that. That's what you just said. It has a real business effect. Lead up listeners. I want to make sure you don't miss that. So many times we think we get paid to just do our job, or others get paid just to do their job. But praise, gratitude, coaching, mentoring, developing others has a business effect, as
Yeah.
Jeffrey just said. When you're known as a great leader, people will recommend others to come work for you. If you're known as not a great leader, guess what? They're going to make recommendations that people
Yeah.
don't to you.
And
There's a business effect to that.
there's such a rippling effect because in a healthcare service organization, patients will also come refer people to you. And if those patients feel cared for, then they bring more patients to you. And I do this talk in my new employee orientation where I can make everybody's jaw drop when I walk into the room as a hospital CEO and I say, I'm not really interested in patient experience. And their jaws drop because it's such a buzzword. And in healthcare, everyone's supposed to be like patient centered. I love the patients. I'm actually by spirit very patient centered. But my belief is if my employees, my staff, my physicians, my caregivers, they feel empowered and supported, then I'm going to trust them to deliver that back to the patients. And that by itself will take care of the patient experience. But
Mhm.
I actually have to think upstream. And I can that talk of to my new employees where I say, you're going to see me in the halls. And when I see you, I'm not going to ask, how are you? Because all you're going to tell me is, I'm fine. And that's your way of keeping it moving. But I
Mhm.
might ask you, how can I support you? And when you ask that question, how can I support you from a leadership role? you will expect to see people pause, and then you can see their wheels turn. And then what
Mhm.
they say next is going to be very different than fine and keep it moving.
Yeah, so good, so good. I want to start landing the plane here. I want to circle back to something that you talked about earlier. You talked about purpose. And I don't want to put you on the spot here, but I'd love to know, what is your leadership purpose? Why is it so important? How do you define it? How'd you discover it? How does one discover it? Because many people think my purpose is to go take care of patients. And that just becomes work at a certain point in healthcare. So I think purpose is much deeper than, yeah, we get paid in healthcare to take care of patients, but purpose is much deeper than that. So talk about that and why it's so important, especially from a leadership perspective. And then how do we inspire others that work for us to also discover and find that for themselves?
Yeah, I'm going to do my best to answer that question. I think as I've had a chance to shape my career over 20 plus years, my ideal job description for myself would be I care for people who care for others. And in healthcare, you don't often get the luxury of picking the people that you take care of. Anybody can walk through the door, different backgrounds, different age, all kinds of different belief systems. And my role is not to get into somebody's politics or backgrounds or any of those things, but to really create an environment where that person feels like they can heal and they can thrive. And you just heard me say, I'll tell my employees, I don't care about patient experience. But I've now seen my purpose as a leader is to create an environment where the patient is cared for, but I have to give a lot more energy and structure and resource and system around that employee experience because the people in healthcare are really not replaceable. And we can't just reduce them down to a function. We're going to be in a lot of trouble in the future, in a very near future. We have doctors that no longer want to be doctors or nurses that no longer want to be nurses. And I have a lot of physician friends. What's really like a red light alarm bell for me right now is most of my physician friends would not recommend their own children follow them into medicine. And if you start having real conversation around that burnout and all the other demands on people's time, you realize we've kind of lost that purpose and that original rally point of we just want to make a difference and we want to help others and that nobility of coming into healthcare. And we've replaced it with all these other things that are deemed important, but do they really matter?
Mhm.
And so my purpose is to try to focus on the things that matter and bring people with me because I can't do it by myself, which is where I need the systems. That's where we need the structure. We need the emphasis on rounding as a team, not just checking a box. And I'm excited by the idea that we always hear about all the things that need to be changed and fixed in healthcare, but there's a whole community of leaders and emerging leaders that really want something better, and connecting people back to that purpose is really where the change happens.
Yeah, so good. I believe purpose is everything. For me, I'm really kind of lucky. I'm blessed, Jeffrey, that I'm self-employed. I started my own business 20 years ago. Over time, I've kind of really narrowed in on my purpose, and kind of my tagline for my business is delivering excellence in leadership, personal growth, resources. And I believe that's what I get up to do every day is to deliver excellence in leadership ideas and thoughts and resources to help people grow as a person, to help people grow as a leader. This conversation has certainly done that. I've often said for many years, I've been saying this, the world's screaming for leadership. I feel like part of my purpose is to try to silence those screams. And part of what I do is have conversations like this with leaders or provide resources and do training and coaching and development. I established a definition or a mantra for my leadership years ago. It's really just an old quote from Jack Welch, but it goes like this. When I was made a leader, I wasn't given a crown. I was given the responsibility to bring out the best in others. And I needed to hear that. I heard that many years ago, and I just said, that's going to be my mantra for leadership because I'm aggressive, I'm assertive, I'm loud, I'm proud. I naturally gravitate toward leadership roles. I can follow other leaders as long as they're strong, but if they're not, I'm gonna take charge. That's just the way I'm wired. But that doesn't mean I get to wear a crown, right? But really, my job is to bring out the best in others when I'm in
Yeah,
a leadership role, just like being a CEO.
as leaders, we are responsible to, we are not responsible for.
Yeah, so good, so good. Hey, Geoffrey, this has been a great conversation. You and I are kindred spirits in the way that we think about leadership. Certainly, we could probably talk a few hours and never run out of things to talk about. But people may tune us out, so let's maybe come back and do another conversation later. If you've listened to today or you've watched on YouTube, make sure you connect with Geoffrey. That's spelled Geoffrey, Geoffrey Hall. Make sure you connect with him on LinkedIn. He shares lots of great insights on leadership. He's a great networker on LinkedIn as well. If you want to connect with him on LinkedIn, we'll make sure that we provide his LinkedIn link in the show notes of this episode. Geoffrey, thanks for being a great guest and talking about what it means to be an elite leader in today's world.